Good.
Okay, you are called to the local bank for a man with chest pain. You arrive to find a 76-year-old man sitting in the lobby, holding his hand to his chest and complaining of severe pain in his chest. A bank employee reports that the pain started right as he was talking with a loan officer.
Alright, got my proper PPE, is my scene safe?
Yes.
Alright, nature of illness is possible cardiac. I have one patient, do I have any more?
Nope, just one.
Alright, I'm going to go ahead and consider calling ALS, which I am going to, and C's fine. I'm going to say no at this point. I'm going to go into my general impression. The 76-year-old male sitting in a chair, and AVPU, is he alert and responsive?
Yep, he is responsible.
Alright, and what is your chief complaint today?
Chest pain.
Chest pain? Right, I'm going to go into my ABCs. Since the patient is talking to me, I'm going to assume his airway is patent. Is that correct?
Correct.
Right, breathing. I'm going to go ahead and listen to my lung sounds. And have you take a deep breath in and out through your mouth. And how are those lung sounds?
Lung sounds are clear and equal bilaterally.
Alright, I'm also listening to the chest. How is his rise and fall?
Symmetrical rise and fall of the chest.
And is his ventilation normal? And then SpO2.
It's going to be 92%.
Alright, and now I'm going to go into circulation. Can I check your pulse? How's his pulse looking?
Carotid and radial pulse is strong and equal.
Alright, how is his skin color, condition, and temperature?
Pink, warm, and diaphoretic.
Is there any major bleeding known at this time?
No.
Alright, at this moment I'm going to put my patient on a nasal cannula at 2 liters per minute. I don't think he's going into shock just because his color, skin, and condition is fine. And I'm going to note that this is an immediate transport. And I'm going to go into my history taking now. And what are the signs and symptoms?
Chest pain and nausea.
Alright, any allergies?
Penicillin.
Any medications you're currently taking?
Lasix. Captopril. Combivent inhaler.
And pertinent past medical history.
Hypertension and emphysema.
Right, and what was your last oral intake?
Breakfast and coffee 2 hours ago.
And what were your events leading up to this?
Applying for a loan.
Right, and how did this chest pain come on? Was it suddenly, gradually?
About 15 minutes ago.
And does anything make your chest pain worse or better?
No.
Can you describe the quality of your pain?
It's going to be a stabbing pain.
And then does your pain radiate anywhere?
In the middle of his chest and goes back to between his shoulders.
And then on a scale of 1 to 10, with 10 being the worst, how would you describe your pain?
An 8.
And you said this chest pain started about 15 minutes ago?
Correct.
Alright, now I'm going to go into taking my vitals. Is it okay if I take your blood pressure today?
Mm-hmm.
Okay, I'm just going to let this sit up a little bit. Right. You're going to feel just a little bit of pressure. Just try to relax. Right, blood pressure was 116/78.
corrected is 168 over 94.
Alright, I'm gonna go ahead and take your pulse. Alright, pulse was 68, respiration was 18.
Pulse is 75, respirations are going to be 20.
Alright, and you said SpO2 was 92 at this point?
Correct.
And then how are his pupils?
Pearl?
Yeah. Alright, I assume this is going to be cardiovascular. I am going to state my field impression, which I believe it is. It could be a possible MI, or it could be just angina pectoris. My interventions at this time, I'm going to keep them on a nasal cannula at 2 liters per minute. I would administer an aspirin, 324 milligrams, and if nitro was prescribed and available, I would do a tablet of that. Other than that, there's not much we can do right now. And now I'm going to give my report, and I will also reassess vitals every 5 minutes. And my report being, this is medic 1. I have a 76-year-old male, possible MI. He has stabbing pain to the middle, and that radiates to the back. His blood pressure is 168 over 94. Pulse is 75. Respirations are 20. SpO2 is 92. He is also allergic to penicillin, and the medications he are on are Lasix, Captropil, and he also takes an inhaler. Past pertinent medical history, he has a history of emphysema and hypertension. His last oral intake was 2 hours ago, and we're about 5 minutes away.